Bring it on, bring it on.
Ask Media Training Institute, a radio and television protocol school. Identity Emma wana opese waye adwuma radio and television eso wana opese osia camera works, wana opese osia video editing. Enunti se wawie journalism school, anase college of education, polytechnic no wawie, anase university, embo senior high school no wawie, na ayiwani swade hunu se opese waye adwuma radio so anase TV so. Ask Media Training Institute ana mekanfo edi amawo o hostel edi ma ema ene mema. Enunti fa form ne ewo Royal TV officer ewo Kumase ahoju enhyaye so anase Royal TV officer ewo enkran achibota ene ABC ene di enhwani mu omo ga rural bank na esro hwa ahomatofo so a obetumi afrɛ 0540102366. Ask Media Training Institute osi bisa near the bema.
Things in this town, can't you see?
We thank God for another day. It is just by His grace and His mercies. Today on Health Arena, we are coming to look at a very delicate disease, which is even more pandemic than this coronavirus era that we are in. According to World Health Organization, research made on this disease was estimated that 12.6 million people died each year living or working with unhealthy heart. We are talking about atrial septal defect. You are shocked. I was shocked myself, but there is another name for it. A big thanks to A&A Driving School, A&A Travel and Tour, travel with ease, reach city estates and properties. Ask Media Training Institute. If you want to be a journalist, a professional journalist, one of the best media school I recommend to you is Ask Media Practical Institute. In 3 to 6 months, you'll become professional in camera handling, video editing, TV and radio presentation. Ask Media have 2 branches. One is located at Kumasi and Hoju in Shayeso. They are in the same floor with the Royal Television. And Accra, you can locate Ask Media at Achimota ABC bus stop at the top floor of the GAN, Rural Bank. For further inquiries, you can contact Ask Media on 0540-102366. Ask Media na almost bisa na Jedibemao. My name is Tawiah Mavis. We are going for a quick breather. When we come back, the discussion begins. Stay tuned.
Bring it on, bring it on.
Ask Media Training Institute, a radio and television protocol school. Identity Emma wana opese waye adwuma radio and television eso wana opese osia camera works, wana opese osia video editing. Enunti se wawie journalism school, anase college of education, polytechnic no wawie, anase university, embo senior high school no wawie, na ayiwani swade hunu se opese waye adwuma radio so anase TV so. Ask Media Training Institute ana mekanfo edi amawo o hostel edi ma ema ene mema. Enunti fa form ne ewo Royal TV officer ewo Kumase ahoju enhyaye so anase Royal TV officer ewo enkran achibota ene ABC ene di enhwani mu omo ga rural bank na esro hwa ahomatofo so a obetumi afrɛ 0540102366. Ask Media Training.
Welcome back from the commercial break. As I told you, the other name for atrial septal defect is also known as the hole in heart. And today I have with me in a studio a health personnel from the Akuapem North Municipal Health Directorate, Madam Mrs. Esiedu. Mommy, welcome to Health Arena on Ask TV.
Thank you very much.
How do you do?
I'm very well.
Thank God. What is atrial septal defect?
It is a birth defect that causes a hole in the upper middle of the heart, upper chambers of the heart.
All right. What are the causes of this atrial septal defect?
Anyway, doctors know it's a birth defect.
Okay.
That occurs during the developmental stages of a fetus within the womb or the uterus in a pregnant woman. And we have genetics and environmental factors.
All right.
The genetic factors, when a pregnant mother is or have a fetus in the womb and she is being infected by a German measles, also known as rubella, measles rubella, she can be affected with the birth and heart. And also the environmental factors are when a pregnant woman takes alcohol, tobacco, cocaine, or any medication that is not prescribed by a prescriber or a physician, or any substance that can harm a pregnant woman during pregnancy.
All right. What are the symptoms of atrial septal defect?
Many infants don't present the symptoms. It's when you are an adult about 30 years, that is the time you present the symptoms. But some of the symptoms are the person's legs become swollen, the abdomen becomes swollen, the foot, and also she will have a murmuring breath when she breathes. You hear the breathing. And also there are easily tired. She gets easily tired after every activity.
All right. So if, let's say, an individual person, like it's the media work, for instance, it's very stressful, and as a media personality, you know, see, sometimes you get stressed and then swelling of legs and other stuff. Does that mean that you have atrial septal defect?
There are other conditions which you can have, the edema of the legs and the abdomen and the foot, but this is the symptoms related to.
All right. So when does an atrial septal defect patient needs to see his or her doctor?
You see the signs and symptoms like we talk already. Examples like having the murmuring of the breathing, or the swollen legs and the foot, the abdomen. You can visit a hospital or a clinic to see a doctor. On hearing this murmuring and those signs showing, she will detect you having the disease.
Okay, so does that mean, is it only the swelling of the legs and then murmuring whilst in breathing? That is when you need to see a doctor.
There are other conditions which is not, when you see something negatively within the person, your breathing signs, and you can visit the hospital to verify if you haven't that.
All right. So then that means if you see such signs and symptoms in your body, you know, which is not abnormal,
Yes.
that doesn't mean you have atrial septal defect,
No.
but you have to see a doctor. All right. What are the complications of atrial septal defect?
When a whole and heart patient is having a complication, the person, the heart forces itself to breathe, or the blood circulates itself, force itself to circulate. So it can be pushed into the lungs, and also the heart becomes very enlarged because it forced itself to push the blood through the lungs and every place. So it becomes enlarged.
Okay, you did mention of the heart pushes itself to pump the blood. In such situation, when it happens in that manner, what can happen to the patient?
There are some conditions which can arise at that moment, and some are arrhythmias, that's heart diseases. You can have heart failure, cardiac arrhythmia, and those things. HPT, which is hypertension, they can also affect you at that moment.
All right. If you just turn in your channel to Act Television, today on Health Arena, we are talking about atrial septal defect, which is mostly known as the hole in heart disease. And I have with me here a health personnel from Equiapim North Municipal Directorate, Madam Esiedu Dakwa. Right, Mami, back to you. Now, what are the risk factors in atrial septal defect?
Some of the risk factors are when a pregnant woman is being exposed to chemicals or substances which can be harmful to the fetus within the uterus, and also when the pregnant women take tobacco, cocaine, or drugs that are not prescribed by a physician or a doctor.
All right. So if in that case, no, if a pregnant woman take any drugs which is not prescribed by a doctor, can that medication harm the baby or the uterus in the womb?
Some, I may say, during the first 3 months of pregnancy, that's the first trimester, is this time that the baby is developing. So any risk factor or error that enters into that developmental stage within that time can harm the baby or present those infections like we are talking of.
All right. So what are the complications of atrial septal defect?
Some of the complications are the person heart becomes enlarged, so it can't work by itself. It's being forced to work. It's being forced. You will be forced to, so it becomes enlarged.
All right. If you're just tuning in your channel to Axe Television, this is Health Arena and we are talking about atrial septal defect. We are going for a quick breather. When we come back, we'll come back to drive the discussion. Stay with us.
Bring it on, bring it on.
Ask Media Training Institute, a radio and television practical school. Identity Emma wana opese waye adwuma radio and television eso wana opese osua camera works, wana opese osua video editing. Enunti se wawie journalism school, anase college of education, polytechnic no wawie, anase university, embo senior high school no wawie, na ayiwani swade hunu se opese waye adwuma radio so anase TV so. Ask Media Training Institute ana mekanfo edi amawo o hostel edi ma ema ene mema enuti fa form ne ewo Royal TV officer ewo Kumase ahoju enhyaye so anase Royal TV officer ewo Enkran Achibota ene ABC ene di enhwani mu omo oga Rural Bank na esro hwa ahomatofo so a obetumi afrɛ 0540102366. Ask Media Training Institute osi bisa near the bema.
Things in this town. Can't you see?
Welcome back from commercial break. Today on Health Arena, we are talking about atrial septal defect, mostly known as the hole in heart. And I have with me a health personnel from the Atrial North Municipal Health Directorate, Madam Esiedu Dakwa. Right, Mommy, back to you. Now, can a pregnant woman having atrial septal defect transfer this disease to the unborn baby?
Yes. In the means that when she is pregnant and takes substances that cannot help the baby in the uterus, so especially when the mother is being infected with the German measles within the first trimester of development, she can have the hole in heart.
Okay. You did mention something like the German measles.
Yes.
What is that German measles?
It's a kind of rash. It's usually infect mothers who are pregnant during their pregnancy states. It affects them.
Okay. So can this German measles kill the baby?
Yes, it can.
And can if the baby die, can this also lead to the death of the mother as well?
Yes, she can also die. Okay.
So meaning this German measles is very dangerous.
Yes.
How can atrial septal defect be diagnosed?
By taking a baby or a client or maybe an adult to a checkup to see a doctor, by hearing the sound, the murmuring sound, the person, when the person breathes, will identify, or the doctor will suspect she is having the problem. So in this case, the doctor may request for one or more tests to prove if it's so. And some of the tests are electrocardiogram, then CT scan, chest X-ray, and others, so that she can detect from that test.
All right. Today on Health Arena, we are talking about atrial septal defect disease, and I have with me in the studio a health personnel from the Atrial North Municipal Directorate. Madam Esiedo Dakwa. A big thanks to Axe Media Training Institute. If you want to be a journalist, I mean a professional journalist, one of the best media school I recommend to you is Axe Media Training Institute. In 3 to 6 months, you will become a professional journalist in camera handling, video editing, TV and radio presentation. Axe Media have 2 branches. One is located at Kumasi and Hujo in Shayeso. They're in the same floor with the Royal Television. And Accra, you can locate Axe Media at Achimota ABC bus stop. They are the top floor of the Gan Rua Bank. You can contact Axe Media on 0540102366. Axe Media na almost bisa na jedebema. Right, mommy, back to you. Now, how does the heart of an atrial septal defect patient work?
Because it's being infected, it works by itself. So it works force by itself to help the client breathe or other things.
Okay, since you said it works with force, can that force also lead or trigger to another disease on its own?
Yes, of course, because it's pushing blood itself to the lungs, it's spreading the blood to the lungs without entering the circulatory system. So that can affect the person to bring about cardiac problems, like what I mentioned first time, like arrhythmias, hypertension, and those things.
All right. So does the heart work different from an atrial septal defect differ from a person who doesn't have the atrial septal defect?
Yes.
How?
Because there is hole in the infected person, it's being forced, as I said. It works extra than the person who is not having the infection. Theirs works easily, but the infected person's works extra with force also.
So, meaning a person with the atrial septal defect heart works abnormal because the heart forces and then pumps blood.
Yes.
So, can an atrial septal defect patient live normal life like the patient, like the normal person who is not having the atrial septal defect?
Well, you can live when you visit a clinic for maybe repair of the heart, or you are on drugs. It can be.
You did say something like repair. How does that work?
We have cardiologists who repair them for when it's being infected, and some repaired by itself when it is very small, meaning when you are infant, it can be repaired by itself. But when you grow or is bigger, they need to repair it for you by a physician who is a cardiologist.
So how can we prevent atrial septal defect?
We can prevent it whereby when we are pregnant, we should abstain ourselves from taking drugs which are not prescribed by a doctor, or taking tobacco, cocaine, drugs, and exposure to substances that can harm the fetus within the uterus. And also, when you are being infected with the German measles, you have to visit the hospital early for treatment so that you can get infected with the disease.
So how can the hole in heart disease be cured?
No cure yet, but you can visit the doctor so that if it can be repaired, they will repair it for you. If it can't, then they will put you on maybe your feeding, your diet too can help you a little to thrive.
You did mention something like it can be cured, but then you have to see the doctor.
Yes.
What doctors and then what department handles atrial septal defect patients?
The cardiac unit.
Right, mommy. Because we have this particular topic is very broad, and I know we can't cover up everything
Yes.
for today.
Yes.
I want you to look into my camera and then your last word or your advice to viewers.
Okay. My last advice or a little advice I can give to my viewers and listeners is when you see any abnormalities within what we've said, swollen foots, swollen abdomen, the legs, murmuring of the heart when breathing, then even when you see you get easily tired, you have to visit the doctor to verify if you having an infection like this. Also, how to feed yourself. You have to avoid yourself by eating fatty foods, and also you have to eat more vegetables, whole grain fats, whole grains, and also you have to take fruits to help you. And it's important you visit the hospital each time you can't find yourself well. And if you are an HPT patient, that's hypertension, you have to visit a doctor to see you, or you have to take your medications very well so that you can get into that problem, which is the hole in heart. That's my a little advice I can give to my viewers as at this time. Thank you.
Thank you very much, Mommy, for honoring our invitation.
You're welcome, please. Thank you also.
Today, here ends the discussion for Health Arena. Today we talk about atrial septal defect, and as discussed by a health personnel from the Atrial North Municipal Health Directorate, Madam Esiedu Dakwa. A big thanks to A&A Driving School, A&A Travel and Tour, Rich City Estates and Properties, Ask Media Training Institute. If you want to be a journalist, I mean a professional journalist, one of the best media school I recommend to you is Ask Media Training Institute. In 3 to 6 months, you'll become professional in camera handling, video editing, radio and TV presentation. Ask Media have 2 branches, one at Kumasi and Hujo in Shire, so they are in the same floor with the Royal Television. And Accra, you can locate Ask Media at Atrial ABC bus stop. They are the top floor of the gang Rural Bank. For further enquiries, you can contact Ask Media on 0540-103366. Ask Media na almost bisa na jedebemao. I hope you heard what the doctor says. Eat whole greens, vegetables and both as well, and then avoid medication by your own self. Visit the doctors regularly when you see any unusual changes in your body, like breathing or wheezing or swelling of legs and other stuff. Visit your doctor or the nearest clinic for further tests to be done on you to know or to be diagnosed whether it is true indeed an atrial septal defect. My name is Tawiah Mavis on Act Television. I'm out.
Bring it on, bring it on.
Ask Media Training Institute, a radio and television protocol school. Identity Emma wana opese waye adwuma e radio and television eso. Wana opese osua camera works, wana opese osua video editing. Enunti se wawie journalism school, anase college of education, polytechnic no wawie, anase university, embo senior high school no wawie. Na ayiwani swade hunu se opese waye adwuma radio so anase TV so. Ask Media Training Institute ana mekanfo edi amawo. O hostel edi ma ema ene mema. Enunti form ne ewo Royal TV officer ewo Kumase ahoju enhyaye so anase Royal TV officer ewo Enkran Achibota ene ABC ene di enhwani mu omo ga Rural Bank na esro hwa ahomatofo so a obetumi afrɛ 0540102366. Ask Media Training Institute osi bisa near the bema.
Things in this town, can't you see?